Talk about treating and healing sprains and strains and even osteoarthritis. There's an alternative to surgery, or maybe even a couple alternatives. Dr. Brett Lockman from Advanced Sports and Wellness in Spine. Or let me make sure I get that right. Advanced Wellness, Sports and Spine. Let's get everything in order. He's here to tell us about a therapy that he has tried himself in your shoulder, right?
Right. It's called platelet-rich plasma therapy. It's kind of an offshoot of an older therapy called prolotherapy, which has been around for about 70 years. Platelet-rich plasma, or PRP, it's been around in some form for about 20 years in animal models and in veterinary use, but really only in human use for about the past, 6 years or so.
PRP.
PRP.
What does it involve for the patient?
Well, the beautiful thing about it is up until this time, there's really been no great therapy for healing chronic sprains or tendinitis. There's been steroid injections which decrease the symptoms, but so very often the symptoms come back. And if you give too many of those steroid shots, then you can actually weaken the tendon or the ligament, and then you can cause rupture, and then you need to have surgery to fix it. So what we can do with PRP is actually get it to heal. And we do that by taking a little bit of blood from the patient. So this is beautiful. There's no rejection. There's no toxic chemicals.
It's my own blood.
It's your own blood. And we take it and we process it down. We spin it a number of times through a centrifuge, and we take out the component of the blood, the platelets that have all the growth factors on them, and we separate that from the red cells and the rest of the platelet poor plasma once we've spun it down and separated it, and then we can take all the concentrated platelets that were in that full volume of blood, and we squeeze it down to about 6 milliliters, and then we can re-inject that right to the area of injury and the surrounding structures that might also have been damaged, and restore the integrity of that ligament or that tendon and get it to heal.
We have a picture of you getting your shot in your shoulder. This was a rotator cuff that you had initially?
Yeah, I had an old wrestling injury and a Marine Corps injury, and I had some torn rotator cuffs actually on both sides. It was about 70% torn on my right, and that has been almost completely.
So it's an injection? It
is an injection, yeah.
Okay.
It's the only way to, that's the problem, you want to basically increase the growth factors, but you don't want to give growth hormone because that has a systemic effect.
Right, so it's not that. Don't think that. Yeah, we're not saying that.
This is growth factors. It's tissue heal. There's a whole litany of them. I won't go into them all. But basically, you're taking this concentrated amount of growth factors that are on the platelets. We re-inject it. We can actually stimulate healing by peppering the tissue with the needle a little bit, tricking the body into thinking there's a big injury there when it's just a big healing response.
So it rushes to heal itself. And this is for sprains, strains, tendinitis, what else?
You can actually even use it within the joint, intra-articularly, to help with the symptoms of osteoarthritis. It's been used worldwide. Tiger Woods, a number of pro athletes have had this done, and it's saved them from undergoing surgery.
Yes, and I think we're all would like to try to make surgery a last resort.
Sure.
And so Advanced Wellness, Sports and Spine, all going on there. There's all the information that you need, the address and the phone number. And Brett, we're going to have you back as we talk more about different aspects of this, because I think this is a part of medicine or of healing that we don't hear about much.
Right, and I'm an interventional physiatrist, and unfortunately the world doesn't know what physiatry is.
Physiatry, everybody.
And so they know orthopedics, and they think neurology, nerves, or surgery, and we are we sit right in the middle. Everything that involves nerves, muscles, and bones, and restoring function, but without having to undergo the knife.
Wow, this sounds great. You did want me to mention that it's not covered by insurance.
It is not covered by insurance. It's relatively new, and insurance is slow to change their patterns, so much research is ongoing, and we expect in the future it will be. Medicare last year, or a year and a half ago, had it briefly covered, and then they pulled the plug on it.
Well, we'll talk more about that as we have you back. Thank you, Dr. Brett.
Thanks,
good to
see
have
you
you
again.
here again.